It's Tyler's time. It's Tyler's time. Time to break it down. Time to shake it around. It's Tyler's time. It's Tyler's time. What you doing? It's Tyler's time. What you doing? It's Tyler's time. It's Tyler's time. Break it down now. Get tacos, because it's Taco Tuesday. On Tyler's time.
What's up, everybody? My name is Tyler, and you are tuning in to another episode of Conversations with a Natural. And today we have my favorite person in the entire universe. It's my mom! Yay! Hi, Mom.
Hi,
How you doing?
I'm doing okay.
I feel like I know what you've been up to, but tell the people what you've been up to.
Well, been working, and like doing a lot of self-reflection and introspection during this time. I feel like this is a time to do that, set aside just to do that, and just you know spending a little time and not spending a little time with family, and just kind of rediscovering some things about me. Some things I want to change, and some things I want to keep, and some things I want to.
Yay! Okay, so we're just going to do some basic questions and then we're going to dive deep because it's twofold. So we're going to talk about your hair, but we're also going to talk about what you do as a job and how it pertains to everything that's going on in the world today. So if you could just tell everybody your name and your occupation and your hair type if you know it, and if you want them to follow you on Instagram, where they can find you.
My name is Teresa Pearson Blunt. My hair type, a whole lot of mixed up. I don't know. I have some 4B, 4A. I don't know. It's all mixed up in different places. So it's a variety of different types in my hair, and you can tell that when I do it. But anyway, you said to say what I am.
Yes.
I am a mental health clinician at the Zucker Hillside Hospital. And my Instagram.
Yes.
My Instagram. I have two Instagrams. One is TQueenB28. And the second one, thanks to my lovely daughter, I am now going to be using more from mental health. So I'm revamping that one. And that one is called New Possibility.
Okay.
So that's New Possibility.
What has your hair journey been like?
It's been interesting. I had a perm. I begged my mom for a relaxer when I was, I guess, early teenager. She was hesitant and she finally gave in. And it did okay. I did have some time where there was breakage, but mostly it did okay. Where later on in life, getting married, having children, things about just as you change, your hair changes. It doesn't stay the same. There are qualities and things that change. And my changes came from, I found out, because I was on medication. And the medication, part of one of the things it was doing, it was thinning my hair and it was breaking my hair. So I wanted to, and I really, really wanted to hold on to that relaxer, but I came to the conclusion that my hair was breaking and I went natural. Now it has to be got to be about 10 years now that I've been natural. And that journey alone has been very interesting. Training your hair to do what you want it to do. The questions from other people and all kinds of things, and just learning to embrace the different stages of it, the growth, the non-growth, the thinning, the twisting, what works best, So it's been a journey to do that. But I know that my hair is healthier now in its natural state than it was in the relaxed state.
And so, having gone through all of that, like, how do you feel now about your hair? Like, what's the relationship that you have with it?
Oh, truthfully, I get tired of doing hair, so I like protective styles. I do give it a break, like maybe a week, and do it, and then I'm like, okay, Tyler, we got to do something with this hair. Um, with my work schedule and all of that, I get tired of doing and twisting and doing all of that and retraining. So I make sure that when I use a protective style like I have now, that I take care of my scalp and I take care of my hair. Just because it's in a protective style does not mean you don't have to do anything. So I make sure that I still nourish my scalp and my hair while it is being protected. But doing the hair and all that every day, mother is tired. So I go to the protective styles.
Yeah, I think I've gotten to that point where I'm like, okay, I like my hair, but I don't want to do my hair. So that I think that's really the reason why I started, getting into, the individuals and stuff, because I'm like, it's a lot right now, and I'm not really feeling it. So I know you talked about like scalp care. So are there any like particular like products that you like to use specifically for that, or like any kind of oils that you like run back and forth to for that reason specifically?
Well, I there is a product, and actually, I just was talking to her yesterday about it, and she is out of stock, and she will be restocking soon. It's from a young lady named Ebony Fletcher, and she has a company called Hair Crack, and they have a oil that used for the scalp that works really well with the protective scalp. My hair and scalp just like up everything. So I found that this really moisturizes and it stays a while in it. So I really love it, and I'll give you the information so you can include it with this video. But it's a mixture of things, and I don't know everything, but I know that it works and that it makes my scalp feel very, very good.
And I know we just got some pattern, and the oil in there was really nice too. I liked the consistency of it too.
Yes. So that's the next thing that I am going to. I know you put it on my scalp once already, and I am going to try that again to see, how my scalp enjoys it, how long it can nourish my scalp before reapplying and all of that. So it's all trial and error um, with products. You have to see what works best for your scalp and get to know your scalp. Just like you get to know yourself, you have to know your scalp. You have to know what your scalp can take and what's the best thing for your scalp.
Mm. And are there, speaking of products, are there any products like overall for just like general hair care that you prefer to use or that have become like a staple in your natural hair journey?
Oh yes. This is bad because I know this is like an interview. But Tyler, what's the thing? You shake. It's a leave-in conditioner.
Oh, the Cream of Nature one,
Yes,
the spray, the leave-in conditioner spray.
yes, yes.
Yes.
I love that, and I have been using that for years. And it is for my hair and scalp. It is one of the best things. I use it when I have a protective style. I use it when I have my hair out, and it does my hair right. So I will continue buying that one. If I find another one that works, so then we'll see about that one. But right now, that is a staple. I don't care what else I try. This is going to be in my house.
Yeah. I think you've used it so much that the boys have started to use it too, and sometimes they go missing.
It goes missing because my son has discovered it and he uses it and wants me to smell his hair with my product in it. So it's just spreading the love and spreading the wealth. So
Yeah.
it's
Yeah.
just in the house. I'm trying to get your father to use it. So
See how that goes.
see how that goes.
He likes his little comb,
Mhm.
and that's it. And that's it. And do you have any like beauty and style like muses, or if there's like a specific place where you can like grab like inspiration for like new styles and like tricks and tips for your hair? Like, do you have any specific places or people that you usually look to try to switch up your hair, or at least find new ways to take care of it?
Well, as far as I do a lot of crochet styles. So as far as crochet styles, I really look at Leah Lavani, I think her name is. She tries all different types of hair, so I kind of listen to her feedback, and sometimes I make my own judgment, but I will listen to her. Um, her She does the first day install, the first week, and then however long she keeps it in. She gives a review after that. So I listen to her, but as far as anyone specific, I don't have anyone specific um, that I look to. I sometimes get people from you to look at, but as far as anyone specific, I don't have anyone specific that I look to. I kind of see what I like and then investigate it that way. Um, but as far as like someone, I see a lot of things that I like and a lot of things I'm like, when I see something I like, I just I listen to it, I look at it, and I see if that's going to be something for me. Because everything I like is just not for me. I feel it's just not appropriate.
You asked mama for a perm, right? So thinking back, knowing what you know now, like if you could like talk to your younger self, would you still ask for it? Because I don't know, was it like popular, or did you feel some like a need to just change your hair for some other reason beyond your control, or did you just not want to take care of your hair like that?
I had a lot of hair. Um, there were people around me that did have relaxers. I believe Auntie may have had one. Um, but I was tired of the hot comb. That was the truth, and I saw that once you got a relaxer, it was no more hot comb. So I was all on board. That hot comb was no joke. So it wasn't that I didn't love my hair, because when Mama did my hair, it was on point. It was straight. She would do, the latest styles. It was done, and I had a lot of hair, so it was easy to manipulate. I just didn't like the hot comb, the heat and all of that. I didn't like it, so I wanted to. When I looked and saw that, once you get the relaxer, you didn't have to worry about being on that hot comb, sitting down and holding your ears and all that. I was on board. So that was really the reason why I wanted a relaxer. No more hot comb.
I don't think you never used one on me, right?
No, well, you didn't need a hot comb. Your hair was a different texture. So I didn't use one on you or your sister, because neither one of you had the texture of hair that really needed a hot comb. Um, I had one in the house once I went natural and used it on occasion, but I never needed to use it on you or your sister. It was like wash, grease, and go. Do whatever style I was going to do and do it. So you never had that experience of sitting down and had to hold your ear for a hot comb, because you didn't have hot comb hair.
Speaking of Tristan, so Tristan got a perm, but I never did. So,
Right.
like, did she ask for it, or was that like a certain like decision that you were like, okay, well, you can do whatever you want because it's your head. But I mean, she doesn't have it now, but like at that point in time, did she ask for it?
Or did
And
she
like,
ask for it?
mm,
She asked for it because you know the struggle with the heat and the puff.
mm-hmm,
So how the humidity just makes your hair just puff up. So she kept asking, and she kept asking the same as I did. So eventually I was like, okay, you know. And she had it for a short while, and she decided she didn't want it anymore. So, I made sure that the person that did it was someone I trusted. I took it, it was professionally done. I would not do that at home. And she had it for a while, and then she decided that that was not what she wanted for her hair anymore. But
yeah.
you always said that you didn't want one, and you weren't getting one anyway. But that you made it very clear that you did not want one. So
I think that it was always very interesting, like watching Tristan's hair and then looking at mine and realizing like all three of us had completely different hair textures. And so, like, eventually when I started doing your hair, I was looking at your head like, oh, my hair don't look like this. It don't feel like this. It don't curl like this. But it's all in the family.
it's all in the family, and it's completely different. Just in the family history, your great grandmother had you have hair like your great grandmother, and she never had a hot comb or she never had a relaxer. She had long hair that curled and that she used to just braid up and put into like little circles or whatever. And it kind of skipped us. I'm not mad. And you guys you got it. Tristan has um, you have more of it, and Tristan has some of it. So yeah, but we all three have different types of hair, and like I said before, because I am on medication, my hair is really different. It is growing, and you know that because you do my hair sometimes. It is growing, but it's not getting the thickness, and that is due to medication. So anyone who is on medication, and your hair is not getting thick the way you would desire it to be, more than likely it's because of the medication. And just still take care of it, still get your ends clipped and do all that needs to be done. It still can grow, it still can be healthy. It just may not be as thick as you would like it to be.
I think we're gonna switch over to the mental health side of the interview soon. But as far as like, I think I mentioned it before, but if you could talk to your younger self, what would you tell her now? Like, with all the things that like if you could just talk to her about her hair and the ups and downs that she might go through, like anything that you would just want to know, like in hindsight and stuff like that.
Well, as far as my youngest self with her hair, continue to enjoy it in the state that it is in. Um, in At that time, all we knew was a hot comb, not knowing that there were other ways that we could do our hair besides a hot comb, and it was about getting your hair straight. But just enjoying your hair and then finding different ways to do your hair. Leave the relaxer alone, um, and just embrace that. And as far as life is concerned, don't be afraid to step out and do things. If someone hasn't done it, if someone has done it, just don't be afraid to step out and say, this is what I want to do. This is who I want to be. This is where I want to go. And just be you and enjoy that. Learn who that is and just embrace it. And even if it's different from what the norm is or what society says, just embrace it. Don't be afraid.
Yay, that's so nice. Okay, so you mentioned that you're a clinical mental health clinician. Can you just give everyone a brief description of what exactly comes along with the job?
So at this particular venue where I work, we have, I work inpatient. I did work outpatient, and that was completely different. So now I work inpatient, and I see a lot of, there are a lot of mentally ill people who come through our unit. And our job is pre-COVID, it was to conduct group therapy and individual therapy sessions. Post-COVID and during COVID, um, we're doing no group, or now they're trying to phase like small groups in, but mostly individual sessions. And what we do is we conduct talk therapy with the patients on the unit. We check in with them on admission at least once a week, and on we help with their discharge planning. We work with a multidisciplinary team, which includes the psychiatrist, the social worker, the mental health clinician, and the nurses. And we have mental health workers who are sort of like the nurse's aide, kind of. And so we have those team meetings where we talk about the patient's care and we discuss discharge and things like that. So pretty much I conduct talk therapy sessions rather in a group setting or in an individual setting with patients who are admitted to the hospital.
And when did you realize like that this was the career path that you wanted to take?
Oh Lord. So if anyone knows me, they know that I've really been doing this for years without education. Anyone, this has just been something that I've done and I didn't realize what I was doing. I've always had people come tell me what's going on with them. Um, some people I know and some people I met on a train and things like that, they just tell me what's going on. So it's something that I've really been doing for a very long time. And I really didn't understand that this is where God was leading me. So I went to school. I was a director at a preschool, and I was going to school for my master's in special education and early education. The school closed, and I continued that master's, graduated, and realized that I did not want to teach anymore. I did not want to be a part of the school system anymore. But I wasn't sure what I was going to do. And let me interject and say I was 50. So I yet went back to school again to be, and I received a prophetic word, and I went back to school to be a clinical mental health counselor. I had to complete 3,000 hours of therapy with other people and take a test, which got held up by COVID. So that's soon to come. But this is something that I've always loved doing, and I knew I was at the right place. The first day of class when I think it was counseling one, and I sat down and the professor began to speak, and it was just something in my whole body. It was just like, this is it. This is it. So I love what I do. I would change some aspects of it, but I know more is to come. So I've been doing this untrained for a long time. But now that I have the training, I love it, and I love what I'm learning, and I love what I'm learning about not only the patients. I love what I'm learning about myself.
Yeah, it's funny that you say that because you talk about like you you get kids, like people just kind of like gravitate to you. Yeah, I mean, and daddy too, but you guys, like, people just like you guys, like they don't even know you, and they y'all start talking, and then like y'all still talking, and then you still talking, and it's like, oh, okay, all right, and then you realize it's like, okay, yeah, this is what she's supposed to be doing, and it fits. People always say like your mom's such a nice person. I'm like, yeah, and it's no front. It's this is genuine. Like, this is the person that she is, without a doubt. So
Just I want, and I've always told you all, the four of you, even when I was teaching and you would come to the school. At the time I was at Christ Lutheran, and you would come to the school, and you and your and the and Joshua would come to the school, and like, boy, Ma, you sound like you're talking to us, because I want for them the same thing I want for you. I want them to succeed. I want them to progress. So I speak to them in the manner. I mean, of course, I can individualize it more with my own than I can with the students, but the my desire and what I want for them is genuine, because I want for them the same thing I want for you. And I would want whoever is teaching you or whoever is leading you to feel that way as well. I know, everybody's not me, and I'm not saying that, but to me, if you're going to do both of these positions, fulfill both of these roles in life, you need to have that genuine um, feeling about it. Needs to be a passion. It needs to be a passion, not only about your own, but about the people that you encounter. So when I have a session, I genuinely want the patients to do well. When they leave and they are not 100%, which they won't be when they leave us, but some of them need more therapy. I am praying that they continue with their therapy, because I want them to do well. Yeah, I've been talking to people. It's a running. I don't know if it's a running joke, but they're just like, "All right, go talk to Miss Blunt."
she
But I'm just prayerful, even in session. God give me the words to say, because if He doesn't give me the words to say, then I'm gonna mess it all up, and that's not what I intend to do.
speaking of the kids, do you think that becoming, like a clinical mental health professional has helped you be a better parent?
I think that that's an interesting question. What I believe is that it has given me an insight that I didn't have before. I see that, because um, I encountered people who are the age of the four of you. From the time I entered, I'm like, I'm in just a story. When I was an intern, I shadowed one of he's now with colleagues. I shadowed him doing a group therapy, and I shadowed him on a college unit. And it was your first year of college. And I'm telling you, I had to do some major talking to myself. Teresa, get it together, get it together. Because in my mind, all I could see, I'm like, oh my God, these children are Tyler's age. And therefore, the grace of God could be Tyler. It could be Tyler. So it gave me some insight into maybe some things that you all may be encountering that your dad and I are unaware of, and things that are happening out of the world that we are unaware of. It also gave me an insight to really come to the realization, to be thankful, to be even more thankful that, okay, you got to fuss about cleaning your room and washing the dishes and, but that's it. I have not had to go to anywhere to pick any of you up for whatever reason. So it made me grateful and appreciative, but it also made me a little more sensitive to some of the issues that any of the four of you may be encountering just from being involved with the patients. So I don't know if it's better, but I think it's definitely a side that I would not have tapped into had I not become a mental health clinician.
I think it's really useful for that, especially um, like if I've come to you with my own problems, then I think, it's just been easier to talk and, get a kind of an outside in perspective, if that makes any sense. But yeah, I think it's been really helpful, and I'm just glad that you like what you do.
The profession can weigh on you and you can become tired. So a lot of times we have to take our own advice. A lot of times when I hear myself speaking to my patients, I know that I'm speaking to myself as well. I have to be first partaker. So while I'm helping them to explore and identify different ways that can help them cope through whatever situations, I know that there's some ways that I can pick up to help myself cope through different situations as well.
Speaking of your patients, like the people, um, especially during now, like the pandemic, has there been like a specific demographic that's been particularly more, well, that you've seen more of at your job, more intake patients, as you say?
Well, my unit is an adult unit. So I can't really speak. We do have an adolescent unit that begins at age 12, I believe. It goes to 12 to 18. I think it's 11 or 12. But my unit is adult. So we go from 18 to, it's supposed to be 65, but sometimes we get over 60 if the Jerry's are full. What we've noticed, and I want to mention that we've been full the entire time. What we've been seeing lately has been an influx of middle-aged men of all cultural backgrounds, pretty much for the same thing: depression, anxiety, suicidal ideation, suicide attempts. A lot has to do with COVID. Some of them either had a spouse that was positive or they were positive at one time themselves. Um, and some of them have lost employment due due to COVID, or have the employment has been decreased, or some of them are just in a bad state, for lack of a better word. That's not clinical, because of what's going on in the society, and they're scared. So middle-aged men of all backgrounds.
And especially like with the pandemic, like what has it taught you about the state of mental health in America right now?
That we don't have enough of it. So I was looking up some statistics, and the United States has the highest rate of suicide. And there are other countries that are handling it a little bit better. We are low in the area of professionals, and we are on the end of the totem pole, one, because of our insurance, and because we don't have the um, the same amount of clinicians, and we don't treat it. The priority is different. The priority for mental health is different in other countries than it is in the United States. People's talk therapy sessions are limited. Some who need specialty talk therapy, whether it be DBT, um, if they need a specific methodology of treatment, there are not a lot of places that have it. The waiting lists are long. It's hard to get people in. The insurance won't pay for it. It'll have to come out of pocket. So a lot of people are getting lost in this whole thing. They're not being able to get help. for those who are actually reaching out, not even talking about those who just won't reach out for help. We knew that before the pandemic, but we definitely know it now. There's not enough help for mental health. And it's so funny because one of my children was insistent that I see the Joker, the movie The Joker. And she's like, you're gonna love it. So I'm like, the Joker. So I watched the Joker, but really the aspect that she thought that I would enjoy, and I did have a whole discussion on it, was that his services were cut off and he was not able to get his medication. That is a reality. There are so many people, and what happens, they wind up coming to the hospital. They have not had medication for 2 or 3 months. So their symptoms have exacerbated and they are mentally, they are ready for hospitalization. We desperately need to really make this a priority. Yes, now our PCPs are asking mental health questions, and that is great. But the next step needs to be is that they need to have access to a mental health practitioner, rather by insurance or whatever the case may be. We see so many people on the street, we see so many people in the hospital that need the help. We discharge people, and before they're gone, a new name is on the board for someone coming in. So we need more clinicians. We need more Black clinicians. We need more services that people can afford or that are covered by the insurance.
Specifically in New York City, where we are, does the same apply? Are we still lacking on that front, or do we have at least a little bit more services that are available to people that need them?
We do have services. Definitely during through the pandemic, it's a little challenging, but we need more. We need more mental health housing. We need more services that are open. We need clinicians to fill spots in agencies that are opening. So we do have some, and I have to really shout out my colleagues, the social workers. They work trying to connect people to resources so that when they leave there, their journey can continue. So we do have, but we still need a lot more.
I know you mentioned it before that more Black clinicians are needed. So, like, for you being a Black mental health clinician, like, how important is visibility in your field? Because when I was at school, people were at a loss because they didn't really have anybody to talk to. So how important is it for more people to really think about genuinely taking this route to become mental health clinicians?
Sometime in the hospital, I have had many of the patients ask me to be their therapist outside of the hospital. Now, that's something I cannot do, but because we develop a rapport, and a lot of times it's because, I'm Black and they're Black, and they feel that I can relate to them more. So it's important for those who are thinking about it. I can answer as much as I possibly can, question-wise, for inpatient care, and I've done outpatient. But we need to be visible in the world of mental health. We are here to be an asset to the world, no matter what your degree or license is. If you can conduct therapy, or if you can, if you are a psychiatrist, whatever your field is in mental health, and you are a person of color, we need you. So I take pride that I am a Black woman that is a mental health clinician.
Because I went to Quinnipiac, and if you don't know, Quinnipiac is a predominantly white institution, and that kind of spills out into all the sectors of the school. So especially in the health department, wellness thing, I don't remember what it's called, but where we had like nurses and doctors, and then we had like the therapist or the mental health side of the things, and it was very small. Like, you could see, I guess it was there for necessity and not because they wanted to put it there. And a lot of, like, we had a couple of people, like a couple clinicians of color, and one was black. I don't remember what the race or ethnicity of the other two were, but they were all three of them were people of color, but it was only three out of the whole entire staff that worked there. So it was just like, the urge that we wanted to go, but wouldn't feel like we would be completely understood. And I think it really is important that people, especially in our community, that we really make sure that we're trying to, if this is genuinely something that you want to do, I feel like it's beneficial for you to, offer your services and completely be there for, the uplifting of our people and stuff like that.
Now, I do want to add that when you are trained as a mental health clinician, you do go through multicultural training and things of that nature. But definitely, because there's such a stigma about mental health, and this is where some of even, I would say, even the lack is coming from the government on down. It's such a stigma. All they just need to take their meds. All they just need, but okay, so why? People just don't jump up and act the way that they're acting. There's something that has transpired. And you asked me earlier about, does did this make me a better parent? And I talked about the insight. This same insight I've gained for people. I look differently now. I'm like, okay, something had to happen. But there's such a stigma surrounding mental health. So it, first of all, is challenging to get people of color and people to seek help. So we need to destigmatize mental health and let them know that, hey, if you need help, it's okay. I often talk to my patients who are not complying with their medication, and I compare it to physical. If you had hypertension or if you had a medical condition, what would you do? And they tell me they would go to the doctor, and if the doctor prescribed them medications, they would take it. So I ask them, what is the difference between that and your psychotropic medication? And it makes them think. It's the same thing. You have a mental health diagnosis, you need medication and talk therapy together. They go hand in hand. And I compare it to medical. Sometimes we stop at the medical. If I have hypertension or diabetes, or if I have, something like that, to take medication. But if I'm bipolar or I have anxiety, I need to take medication. So we need to destigmatize all that and make sure that people are getting the full treatment that they need. If they need medication, that they're getting it, but they're also getting the talk therapy that goes along with it to find out, why are you anxious? Why are you angry? Why? Some people are stuck at the age of 7 and they're 57. They have not been able to work through what has transpired from the age of 7. They've carried that like baggage on them from the age of 7, and now they're 57 and they're not able to keep a job. They're not able to maintain a relationship because of something that happens when they were the age of 7. And every time something similar occurs, it's a trigger, and they go right back to age 7 again. Wish above all things that you be well, that you prosper, even as your soul prospers. So it's important that we promote wellness from the inside out.
I think I'm learning that now, that physical and mental health, they just go together. Like, you can't just ignore one and pay attention to the other, because then one will start to lack, and then you'll be like unbalanced, and then you'll have to start doing extra work to take care of yourself, where you wouldn't need to do that as much if you had just tried to put them together. So I think it's good that I'm learning that now, while I'm 21, almost 22, and being really mindful of my surroundings and the people that I'm surrounding myself with, and all that good things. I have you and Daddy along the way, so it's just good that I'm surrounded by all these people, but still keeping in mind that a lot of people don't have this support system. And yeah, and that's why I think like with the series now, it's like I think it's important for other people to get this kind of information. And
now we're at a point where masks are mandatory. But in reality, people have been wearing masks long before they were mandatory, because we're covering up how we feel. We're covering up what has transpired in our life. We're covering up those experiences that are still we are broken inside. So we're covering up the brokenness with a mask. Now, physically, we have to wear a mask, but many of us have been wearing that mask for years. We're still broken. And in order for us to move to wholeness, there are things that need to be done with our maybe physical health, but excuse me, definitely with our mental health. So yes, we have to wear physical masks now, but we've been wearing masks for years. It's time to take off the mask. And if you're not okay, find someone who you trust and tell them, listen, I'm not okay. Especially with COVID. I mean, as a clinician, the anxiety that I felt was real. And, a friend said to me, do you know all that you're doing? So of course, but sometimes you don't realize what you're doing. But this is an anxiety provoking time. So if you're not okay, I encourage you to find someone you trust and let them know, let the journey begin by first admitting, I need help.
what would you say to anyone right now that's kind of struggling with their mental health? What would you say?
If you're struggling with your mental health and you know that you're struggling, it's time to reach out for help. If you don't know where to go, definitely go to your PCP or call your insurance if you have insurance. They should be able to direct you from there. But I want you to know that if you're struggling with your mental health, let someone help you. If you've done all that you can or you don't even know what to do, then let someone help you get through this portion of your life. And understand that when you're struggling does not define who you are. This is a part of your life. So let's help you get through this part that you're struggling with, whether it be COVID, whether it be, excuse me, the loss of people by death or separation, whatever it may be. There are telephone numbers, the suicide hotline, and I'll make sure that it's included in this video. There are even telephone numbers that you don't have to, if you don't feel comfortable speaking, you can text and they will respond to you.
There are also like therapy apps as well. I don't know if some of them you might have to pay for, but I know there are some free ones, some specifically for the Black community. There are Black Girl Therapy. There's like Black Girl Therapy Instagram pages where you can, find, a clinician or somebody to at least just talk to for the moment. Just any and every resource that we can possibly provide for you. I'll make sure to put that in the description box below, and I might just stick some of them at the end of the video.
If you're into podcasts, there are a number of podcasts. As Tyler mentioned, Black Girl Therapy, their podcasts are phenomenal. There are a number of other things, and we'll make sure that they're listening. If you are a person of faith, please utilize that. Studies even show that people who have faith actually do better, because you have faith and support are two important things when you are struggling with your mental health. So tap into that. If you have a relationship with your pastor, I urge you, or one of the clergy, get in touch with them as well. If you're a person of faith, find something in the Bible, a scripture in the Bible, meditate on it, write it, put it up, continue to speak it, declare it over your life in conjunction with your talk therapy. Do it, declare it. And that is working on your mental health as well.
And as we're going to close this out, I just want to give my mom just a minute or so to just, give any final thoughts, any final words she has to say about mental health or, the state of the world right now, anything that she just has on her heart. So take it away, Mom.
I believe that this time is a time for us to check on us and not spend so much time worrying about others. I'm not saying don't check on people, don't care about people, but it's time to reflect on what's going on with you and to focus your attention. For me, is focusing my attention on God so that I know the next step to go. I know what to do. I know how to do it. I know how to implement it. Um, Mental health is so important, and it's something that every day that I'm involved in it, I grow to love it even more. I learn things about my patients, and at the same time, I'm learning things about myself. I encourage you, whatever you do it for you. Don't do it for anyone else, because it won't profit you anything. Do it for you. Whatever you feel you need to get, if it's getting your mental health together, getting your physical health together, getting your hair together, getting your life together, whatever you do, let it be for you. The world is waiting for you. So let's take the mask off. But then when you go outside, put it on. And they're either going to like it or lump it. It's not about them, it's about you.
Yay!
Please Hercules.
And I just want to say, thank you for doing this and, coming on the little talk show and talking about, mental health and, everything that's really going on. And, I love you, Mom. You're the best, baby. Virtual hugs, virtual hugs, kisses.
I am so proud of you for finding a venue that you can express yourself in. This time has been a time of, as I said earlier, of reflection and introspection and finding out more about yourself. So I am so proud of you that you are taking a step and doing something new and out of the box for you. You don't know where it's going to go. So I'm continue to pray for you, but I am so proud of this venue and I can't wait till more people see. I mean, not only this one, because it's spectacular, but all that you have coming down the pipe. And I think it's a wonderful thing. And I think the conversations, even with the hair, is something that needs to happen, because everybody has a relationship with their hair and it's not always lovely. So, pouring into people, encouraging them about their hair journey is a fabulous thing. So I'm proud of you.
Thanks, Mom. And don't forget to like, comment, and subscribe. Yes, subscribe to this channel for more videos like this and hair tutorials and all kinds of wonderful things that I'm planning on doing. Stay safe, wear your mask, stay beautiful, y'all. Peace.